Dr. Purvi Parikh, welcome to ITV Gold. How are you doing today?
I'm great. How are you?
Not so bad, trying to just keep safe and healthy. I have so many
Mhm.
questions for you. There's so much happening across the nation. So let's go right into it. My first question to you has to be about the cases that are surging across the nation. The Midwest is getting really badly hit, but we're also seeing surges in the Northeast, which is concerning a lot of us living in New York, New Jersey, and other states. Why are we having this surge right now? Why can the Midwest control or contain the spread?
Mhm. Yeah, so there's a few things going on. All of these respiratory viruses, COVID-19, flu, they spread more in the winter months because as it gets colder, people spend more time indoors. And so inside in enclosed areas, unfortunately, the virus spreads more quickly. If you remember, even COVID-19 emerged even during the winter time last year. So basically, that's the biggest issue with the Midwest states because many of them are already experiencing the beginning of winter. And then in tri-state, it's similar. I mean, it is starting to get chillier, but also I think, people have to be very careful because as we let our guard down and have more indoor gatherings, the cases will go up, especially as we move towards the holidays. Dr. Anthony Fauci is actually recommending not traveling or having large family gatherings for Thanksgiving or Christmas or even Diwali because it can be dangerous.
Yes, definitely. If I was to ask who or what is the major reason behind this surge, what would you say? Who has the
I think
responsibility?
Right. So, I think it's a combination of things. All of us have a big responsibility because, we're the ones who have the most control over our actions. So that responsibility includes, wearing masks, social distancing, not having or attending large gatherings, especially now that more things are happening indoors where we know the virus can spread. So I think number one responsibility starts with all of us. We're all accountable. But then secondly, government officials do need to step in and even think about things such as mask mandates, even for the whole country as we move towards colder months. I
Yes.
know other countries, as they're seeing their cases go up, already announced mandates. Like Russia announced a mask mandate for the whole country. So we may have to do strict measures like that.
Do you think perhaps certain areas should be shut down? France has just gone into a nationwide lockdown. I'm trying to understand with the 71,000 average daily new cases that were reported today, where are we heading towards?
Right. I mean, nobody wants a lockdown, because we know that our economy suffers, people lose jobs. It's not good for mental health, but, we might have to do temporary lockdowns, maybe not of entire areas, but of the clusters or the hotspots. So, for example, in New York City, what we're doing now, and in New York State, Cuomo is targeting regions where there's hotspots where the cases are going up rather than shutting down entire regions like we did before in March or April. So hopefully that way we can control the spread without having a very large lockdown. But if we can't get ahead of it, we might be heading for the larger scale lockdowns, unfortunately, again, which I hope is not the case.
There was also a prediction today by one of the health experts saying that we may see 100,000 new cases on the daily average of 7 days that we're talking about. Do you see that happening?
It could be. I mean, we're already seeing more daily cases per day than even at the start of the pandemic, so they are going up and they've been steadily going up the last week or two. So it is a reality that we have to, come to terms with. And it's even more reason that we really need individuals to take this seriously and local governments also to take it seriously.
Are you perhaps worried that New York City may become the epicenter again? I guess we're all worried about that.
Right. It's definitely a worry. It was very traumatic, being in New York City in the tri-state area during March, April, May. But, interestingly enough, currently New York City is in a better position than most of the country. Luckily, even though there are a few hotspots in Brooklyn and Queens, overall, the city has maintained a relatively low infection rate, I think of less than 2%. Hopefully, if we stay under that rate or even get lower, we can continue to do well. But now it looks like other places are slowly becoming epicenters. So
Yes.
I think at least New York City has done a good job of keeping it under control. But, nobody knows what the future holds.
Dr. Parikh, some of these hotspots are currently hosting rallies as we speak for the presidential elections. And, we haven't seen many on mask mandate either. If you were to advise these states that are becoming hotspots, what would you say?
Yeah, I mean, I would definitely advise these states that, at the very least have a mask mandate, but then also try to limit these large scale events, try to, have limits on how many people can attend, make sure those people are wearing masks, even screened, maybe with temperature checks before entering. I know in New York City, the government caught hold of a 10,000 person wedding and luckily stopped it before it was going to happen, because that would have also been a disaster. So any large scale event, we have to be very careful and either not attend, especially if you're in one of those high risk groups, or it's up to the local officials to not let these events happen.
Dr. Parikh, nationwide hospitals are getting overwhelmed again. The healthcare system is getting overwhelmed again. What is needed from the government right now, according to you?
Right. So, again, some mandates for public health measures. The masks are one thing, but then other than that, they might need to again mandate those gatherings that occur. If we want to avoid the large scale lockdowns or shutdowns of businesses, we have to at least limit what people do personally, during their free time. So these are all things that we need to take into account. Also, rapid testing as well as contact tracing is important, because if you're able to identify someone who's positive and everyone they've come in contact with and isolate them, then you can quickly stop that spread quickly. So hopefully those measures will be helpful. And we're looking to see that hopefully a good, reliable vaccine is approved. Okay. And don't forget, it's also flu season, and already our hospitals get overwhelmed every year, even when it's not a pandemic. So we are all strongly encouraging everybody to get their flu shots, and the government should also encourage that as well.
Have you seen any interactions between the seasonal flu and COVID-19?
Well, not interactions in the sense that of the two viruses interacting, but we're already seeing flu cases in New York and some of the Midwestern states. So, we don't want our health systems to become overwhelmed and that our ICUs don't have room for COVID-19 patients because it's full of flu, or vice versa. So they do have a potential to cause what they call a twindemic. And if we have two pandemics going on at the same time, it's going to be much worse than what we even saw in March and April, because the hospitals will become even more overwhelmed. So again, we're encouraging people to get vaccinated. The masks, hand washing, social distancing, it helps for all spread of all viruses, so hopefully we'll be able to reduce both flu and COVID-19. One piece of good news is that places like South America that were in lockdown during their winter, and Australia, they actually had less flu cases than in previous years because people were so strict about COVID-19. So I'm hoping that maybe we'll also get a milder flu season if people take things seriously.
Yes, for sure. And it's so important to get your flu shot. I again want to reach out to all of our audience here while you're there with us to get your flu shot. It is so important. Just discussing a little bit more on these overwhelmed hospitals. Do we have enough PPE supply for doctors in case there's a second surge, especially in the Northeast? Are there enough beds? Are there enough ventilators? What's your take on it?
Right. So, the idea right now is that we don't want to end up in a situation like we were before. And I'm hoping that these officials are learning from the mistakes to make sure that there's enough PPE in stock, that there's at least 30% capacity in all the hospitals. I know those are kind of the regulations that New York has in place, so that as soon as we start, running low on that, things start shutting down and more, strict mandates are placed. But that being said, unfortunately, I am getting reports from across the country that there still is not adequate PPE. And I'm not quite sure what the reason is. Before this pandemic started, like N95 masks, all masks, we would dispose of them after one single use. And that's how they're meant to be. But I'm still getting reports of healthcare workers needing to reuse these for days at a time. So that tells me the PPE problem is still not solved. Why are we reusing disposable products?
Yes, for sure. And I think the government has a lot to do with this. They have to really, have us get all of this PPE supply. And I know a lot of other organizations were helping too, but I think it has to come from the government. I want to talk to you about these vaccines and therapeutics. Today, Eli Lilly made a deal with the US to supply 1 million doses of the monoclonal antibody. We have heard about it since President Donald Trump's COVID-19 diagnosis, and that's where he was given something similar to that. Could you describe to us what's happening in this monoclonal antibody, and is it really a good therapeutic for COVID-19?
Right. So, it's being studied because, as we know, with COVID-19, people present completely differently. One person can have very mild symptoms. One person can pass away. Some can have, strokes, neurological problems. So it's very, very different person to person. So it's good that we have multiple therapeutics being approved, because something that might work for me might not work for another person, right? So, well, the way these monoclonal antibodies work, Eli Lilly has one, as well as Regeneron, and the president received Regenerons, is that they bind to the virus in your blood, and so that they lower the amount of virus circulating in your blood. And the idea is that by doing that, it makes you get better faster because there's less of the viral load. The good news is that they're trying to get these antibodies approved for outpatient use, meaning if someone gets sick, and they can get a shot of these monoclonal antibodies, and maybe that will prevent them from needing to end up in the hospital. So because we're focusing a lot on prevention right now. So that's a great therapeutic if we do see that it's safe and it works well, because we can actually give it to people outside the hospital to prevent the hospitals from getting strained or overwhelmed. So I think that's very exciting. And I'm hoping also that, there is at least a vaccine approved before the end of the year. I know it will take time for everyone to get it, but that's another thing. So prevention, I think, is key and should be the focus for a lot of these therapeutics.
Is there some insight you can give us in the vaccine development? I know you're working somewhat in that space as well. There are so many pharmaceutical companies across the world working on this vaccine. What updates do you have for us?
Right. So, in the US, we have 4 that are currently in clinical trials in the last stage before FDA approval. So that's Moderna and Pfizer, who both have similar vaccine technologies, the mRNA vaccine, and then also AstraZeneca and Johnson & Johnson that have similar vaccines as well. Now, AstraZeneca and Johnson & Johnson were recently placed on hold due to safety evaluations and, safety checks. But the good news is I heard that AstraZeneca is now resuming this week. They got the green light from the FDA. Johnson & Johnson hopefully will resume soon as well. But I do believe that one of these 4, or maybe more, hopefully will be approved at least before the end of the year. So we can start giving it to those high-risk groups, like healthcare workers, elderly, people with certain medical problems. And then I think it will take another 6 months to a year to get everybody else vaccinated. So, fingers crossed. So far, the results look very promising, actually. It's showing that it is giving immunity, multiple groups. Now, the question is how long that immunity will last. And that's, the million-dollar question. Nobody knows.
And what about the efficacy of these vaccines? How efficient and effective are they going to be, according to you?
Right. So at least I know Moderna and Pfizer, their initial studies were very promising. It actually showed that the people who got the vaccine had a better immune response than those who actually got sick from COVID-19. So that's a good sign that the immune response is strong. Now, the question is, will it last? That's the other thing. We want it to last for at least a year, hopefully more, so that you don't have to keep getting revaccinated, because we are hearing of cases of people getting reinfected, so just getting sick, unfortunately, is not enough to protect you, or no guarantee. Or, so we'll see. And then even I think AstraZeneca and Johnson & Johnson have also shown very robust immune responses in various age groups too. That's what we're looking for. Right now, we're testing it in all the high-risk groups, healthcare workers, elderly, those with heart disease, diabetes, obesity. We definitely want to make sure it works in those. And then another piece of exciting news is that Pfizer announced that they're going to start pediatric trials. So for children at least age 12 and up, because, kids we know are carriers of this disease, even if they might not get as sick as adults, it's still important for them to be vaccinated too.
Yes, for sure. Today, Dr. Anthony Fauci said that we may not see normality or semblances of normality until the year 2022. Do you agree with that?
Well, one, I agree with anything Dr. Fauci says because he's a very smart man and I have a lot of respect for him. But yes, that's a real possibility because even with the last pandemic that was as severe as this one, the Spanish flu in 1918, it did take almost 2 years to get back to normal. So, I'm hoping that, it's a optimistic outlook that it will be less than that, but we need to be prepared in the event that it's not. And it does take that long, especially while we wait for the vaccine to be rolled out. 80% or more of the population needs to get the vaccine for us to get that herd immunity everybody talks about. So all of this takes time, it doesn't happen overnight.
Yes, for sure. Could you actually give us some insight into herd immunity? That was going to be my second question. I only have like three questions left for you. There is a certain section of the communities that are looking at herd immunity as the way to really get truly immune. But then another section is saying that would require 60% to 70% of the population getting infected, which doesn't look like a good, reason to do that.
Right. Right.
How do you look at it?
Yeah. So, herd immunity is important. That's what we are trying to achieve through, for the flu vaccine and other infectious diseases. That's the whole reason we have vaccines. But then people say, well, why can't you just let everybody get sick and we reach herd immunity that way? But that's really risky when you're dealing with a virus that's as deadly and as contagious as COVID-19, because as you said, you have to have 70% of people infected. And when we have something where 200,000 plus Americans have already died from COVID-19, that's very deadly. We don't want to sacrifice, our own friends and family members just to get herd immunity when we can do so through a vaccine without people getting so sick that they're dying, or, people don't realize COVID-19, everyone focuses on the death rate, but even if you survive, some of these people will never be the same again because they either have strokes and long-term neurological problems from that, or kidney disease, or many other complications, lung disease. These people who were healthy before are really struggling now, even 6-7 months later, even though they survived, it's not a good quality of life.
You just mentioned a couple of diseases, and that was my next question to you, and a very popular question that we're getting. We have a lot of South Asian viewers, and the community, again, is a very at high risk community. How do you look at South Asians and COVID-19? And if you were to advise to these at high risk patients, what would you say?
Yeah, so South Asians, I believe, are definitely at a much higher risk for COVID-19 than the general population for multiple reasons. One, South Asians are at higher risk of getting diabetes, heart disease, obesity, metabolic syndrome, and all of those things are high risk conditions for COVID-19. So already we're in a group that's more likely to have high risk conditions. And then on top of that, a lot of the hotspots, like especially in the tri-state area, in Queens are heavily South Asian communities, and we found that especially in the Bangladeshi community, they may even have a certain gene. Scientists are looking further into it that makes them more likely to get infected and get more severe forms of COVID-19. So there's a lot of risks why South Asians need to be even more vigilant. And the same goes for a lot of other ethnic groups, like, African Americans are much more likely to get sick and die from COVID-19. Same with Latin Americans and Hispanic Americans. So yes, absolutely for South Asians, especially because of all those risk factors that we have.
My final question to you has to be, A, do we need to hunker down? And B, what is your biggest concern for these 2 coming months?
Yeah, so hunkering down in the sense, yes. So hunker down for everything non-essential, right? We're not saying completely stop living your life, but, avoid any unnecessary gatherings, avoid having people come to your home that are outside your immediate family, because we do know it spreads more inside. You can still enjoy all the holidays, but, try to do it with your immediate family and over Zoom, rather than traveling around and that potential of things spreading. There was a case a few weeks ago that one teenager actually spread it to almost 11 of her family members across 4 states. And it was all just from one gathering. And even if you do gather with family, you may still want to keep your mask on, especially if it's people you don't see on a daily basis, because you may think, oh, it's just family, I can take my mask off, but there's still that risk of transmission, and you can make, someone in your family very sick. So all of those things we have to do: wash our hands, keep the social distancing up, and just use common sense measures. Get those vaccines that we know already do work, like for flu or pneumonia, if you're someone who is in a high risk group for that as well.
Yes, for sure. Well, I truly appreciate you for your time here, Dr. Purvi Parikh. I
Mm-hmm.
would love for you to give one last message to everybody watching you.
Right. So, the next few months are going to be extremely important. And, it's the responsibility of all of us to kind of keep the transmission down and the cases down so we don't end up in a total lockdown in the middle of winter, especially as it gets colder and we're spending more time indoors. So please, stay vigilant, keep your guard up, avoid any unnecessary travel to other states and cities, and, keep wearing your mask, washing your hands, all of the same things we keep saying, and keep your distance.
Definitely. We're hoping for a mask mandate here. I hope that happens.
Yes, I agree.
Yeah. Thank you again for your time.